Hi everyone. So welcome back to Tuesday Reading Live. My name is Vandana PS, one of the reading trainers from Nidhu's Academy. Okay, so on the previous day we were discussing about a sample question from part B and part A in detail. So like same, we are dealing with a sample question from part B initially. Then we will move to the important part, which is part A. Okay, so before that, let me check how many of you have joined this live session. Okay. Yes, okay. So I'll give you a sample question, and for that I'll give you 2 minutes for doing the question. So here comes the question. Yes, so welcome back to the reading segment once again. So have you all done this question? Okay, so a lot of comments. Hi Shiny, Riba, Neetu, Namida, Roshna, Jessica, Lindsay, Ganga, Reenu, Shija, good afternoon. Hi everyone. Okay, so thank you so much for the active participation, guys. Anyway, so how was the question? Okay, was it too difficult? It was average, right? Okay. So I'll read the question, then we will discuss the answer, okay? So what message is being conveyed in this guideline extract? Okay? So this is all about a guideline, so which comes under the first category. Okay, so what are guidelines? Any idea, Shija? What are guidelines? Okay, so guideline, yeah, in the question itself they have mentioned these are guidelines, so which means, and you know that we have 3 categories in part B. Okay, so this question comes under the first category, those are guidelines. So what are guidelines? Let me know in the comment box, what are guidelines? Yes, okay Shiny, first category, and we are reading for the details. Very good dear. Yes, so what are guidelines? Guidelines, which means a set of principles or rules and regulations that someone has to follow. Okay, and here what message is being conveyed in this guideline extract? So what is the message through this guideline? Okay, so any idea what is the correct answer here? What is your answer? Let me know in the comment box. What is your answer, guys? Okay, yes, Jessica, set of instructions. Very good, yes. Yes, Shija, check for the details. Okay, so if this is a guideline or if it comes under the first category, then we are reading for the details. Okay, so we are reading for the details. And yes, Reba, set of rules and regulations. Okay, Shija, rules and regulations. Okay. Okay, so Shiny got that option, right? Yeah. Okay, you got that answer. Then what about others? Any other answers? What is your answer? Okay, Reba. Anyone else? Okay, so I'll read the options and as well as the paragraph. Then let's do elimination. Okay. So option A. There is insufficient understanding of these systems by most employees, and I forgot something. I have not marked any keywords from the question. So now I'm going to mark keywords from the question. Okay, it's very important. So message, conveyed, guideline. So these are my keywords from the question. Okay, and what about the options? There is insufficient understanding of these systems by most employees. So my keywords, insufficient, then understanding, as well as most employees. Okay, so these are my keywords from option A. And option B, employees are the only people capable of operating these systems. So my keywords, employees only capable. Okay, and from option C, these systems are less effective if employees are not included. So my keywords, less effective are not included. Yes, so these are my keywords from the options. Okay. So I'm reading the paragraph. Extract from guidelines the core elements of safety and health management systems. Most successful safety and health management systems have 6 core elements. Okay, so what are they? For example, if it is a hospital, then the hospital have 6 core elements. Maybe the management, then the doctors, nurses, the patients, okay, other healthcare workers. So likewise, there are 6 core elements in this system. All are interrelated, so everyone is interconnected. Each necessary to success of the overall system. One of these is employee participation. So adil onnaan in the employee participation. So one among that is employee participation. Okay, then employees have. So from that particular, first paragraph we can eliminate one option. So which option you can eliminate? The option namukku eliminate cheyan pattum. Okay, so out of this 6 core elements, okay, employees are one of them. Adil onnana employees, which means you can eliminate option B. Employees are the only people capable of operating the systems. It's wrong. So we have other 5 elements, including 6. That means employees participation. Okay, so it is contradictory or opposite option, right? Yes. So we can eliminate option B. Yes, Shiny, we can eliminate option B. And the rest of the lines, employees have unique knowledge of the workplace and must be involved in all aspects of the safety and health management system. For example, setting goals, identifying and reporting hazards, investigating incidents and tracking progress. Okay, so what are the duties they have? Their own responsibilities and they know about it. Employees have unique knowledge. They have. Okay, a current, they have a very clear understanding about the knowledge of this system, the workplace they have. Okay, so that you can eliminate which option? We can eliminate option A, because in option A they have mentioned there is insufficient understanding. So there is no insufficient understanding, they have the unique knowledge. Okay, so that means again contradictory or opposite option. So through elimination method, my answer is option C, which is these systems are less effective if employees are not included. Okay, and I'm reading the rest of the lines. All employees understand, see, okay, their roles and responsibilities under the safety and health management system and what they need to do to carry out them effectively. Employees are encouraged to communicate openly with management and report safety and health concerns. Then barriers to participation are removed. Okay, so barriers, which means if there is any problem with the language, lack of information or any disincentives, then it will be removed. Okay, so answer is option C. If these employees are not involved, then these systems are less effective. Okay, so that should be the correct answer. Okay, yes, Sharmila, you can eliminate. Yes, we can eliminate option A because it is contradictory option, right? Okay, so let me check your answers. Yes, Shiny, Reba, Sharmila, Ayana, and anyone else? Yes, Reenu and Jessica, you guys got option C. Excellent. That is the correct answer. Okay, very good. So, the method we are following here, which is elimination method or elimination strategy. Clear about the technique or the strategy we are applying? Okay, and what do you know about part B? I'll just condense everything about part B in a short period of time. So, part B, we have total 6 questions. Okay, and the 6 questions will be like multiple choice questions with 3 answer options, and there will be a respected paragraph that you should read. Okay, so it's up to you, ningalde ishtana, whether you can read the question first, then the options and the paragraph, or you can read the question, then the paragraph and the options. Okay, and what strategy we are following here? We are doing elimination method, and what is elimination method? I just did it just now. Okay, so that's all about part B. Then they will not give you the direct sentence or the direct answer in this paragraph from the option, and other than that they will give you the paraphrased sentence. Paraphrased, which means that same meaning will be there somewhere in the paragraph, but entirely different sentence structure will be there. Okay, I hope it is clear. So once again, think about the question, what message in the message aanu kittunnalle? So message, which means that overall idea. Okay, what message you get from this one? So answer is option C. These systems are less effective if employees are not included. Clear? Okay, yes, Shiny and Sharmila. Okay. Okay, so now we are moving to the another part, that is part A. Okay, so we have a new topic, which is sepsis. Okay, so how is the material? The material, was it too difficult or very easy or an average material? How is it, Jessica, Sharmila, Shiny, Reenu, then Ayana, Reba? Okay, so how is the material? I think it is average, yeah. Yes, okay, Reba, it was an average material, not that much difficult, and it's not that much easy. Okay, so let's, so like what I did yesterday, I'll read the text first, then I'll underline the keywords, then let's move to the questions, okay? Okay, yes, Reenu. Okay, Shiny, was it easy? Okay, I'm happy to hear that. Okay. Anyway, I'll read the paragraph, then we will move to the question answers, okay? So text A, sepsis is your body's extreme reaction to an infection. So while I read the paragraph, so please let me know in the comment box what are your keywords from text A. Okay, I hope you guys will do it. So please comment it here. Let me know what are your keywords from text A. In the kyan ningal mark the keywords na. Let me know. Okay. Okay, Namida, it was an average material. Yes, Nimi, yes, Shija, average material. Okay. So sepsis is your body's extreme reaction to an infection. Then when you have an infection in your immune system works to try to fight it, but sometimes your immune system stops fighting an infection and starts damaging your normal tissues and organs, leading to widespread inflammation throughout your body. At the same time, an abnormal chain reaction in your clotting system can cause blood clots to form in your blood vessels, This reduces blood flow to the different organs of your body and can cause significant damage or even failure. Then people who are at high risk include people older than 65 years old, newborns, infants and pregnant people, then people with medical conditions such as diabetes, obesity, cancer, kidney disease, and people with weakened immune systems, then people who are in hospital for other medical reasons, then people with severe injuries such as large burns or wounds, and people with catheters, IVs or breathing tubes. Okay, so these are my keywords from text A. So what about you guys? Okay, so what are your keywords from text A? Let me know in the comment box. So what are your keywords from text A? Any other keywords than this? ഞാനിപ്പോൾ മാർക്ക് ചെയ്തതല്ലാതെ ഏതെങ്കിലും keywords ഉണ്ടോ? Any other keywords? Yes, okay, Shiny. Yes, your keywords are extreme reaction, infection, damaging, clotting system, high risk, obesity, cancer. Very good, very good. Okay, so what about others? Any other keywords? Any other keywords? What about you, Nimmi and Namita? What are your keywords from text A? Okay, I'll read text B. So please do comment your what are your keywords from text A as well as from text B. Okay, so I'll read. So text B, symptoms. See, heading is mentioned, so those are symptoms. Okay, Nimmi, extreme infection. Okay, so those are your keywords, right? Okay. Then from text B, and as well as you can mark also all the numbers, okay dear? So because it is very important, so 65, the number, then hospital, then as well as sometimes the words that indicate time, sometimes, then when, same time, okay, then newborns, infants, pregnant, so those kind of words should be underlined, okay? Yeah, so yes, Roshna, hi Roshna. Sepsis, infection, immune system, fight it, stops damaging tissues, organs, inflammation, abnormal chain reaction, blood clots, failure, older, newborn, infants, pregnant, IV burn, wounds. Okay, oh excellent, a lot of keywords, right? Okay, so these are important words, I agree. Okay, any other keywords? Okay, Namida, sepsis, infection, immune system. Okay, Namida, yeah, we have a lot of keywords here. Okay, so please do read and underline it carefully. Okay. Yes, then symptoms. So what about the symptoms? Sepsis can affect many different areas of your body. So there are many possible symptoms, okay, different areas. Then if an infection such as blood poisoning or septicemia triggered your condition, you may develop a sepsis rash on your skin. The rash makes your skin appear under red and discolored. You may see small dark red spots on your skin. Other common symptoms, sepsis symptoms include urinary issues, then low energy or weakness, fast heart rate, low blood pressure, fever or hypothermia. Okay, then shaking or chills, then warm or clammy, sweaty skin, then confusion or agitation, then hyperventilation or rapid breathing or shortness of breath, then extreme pain and discomfort. Okay, so these are my keywords from text B. So yeah, in text B, a lot of symptoms mentioned. Okay, so what are the symptoms? Yes, Reba, sepsis, immune system, 65, IVs, diabetes, cancer, kidney disease, catheter also. Okay, catheter should be important. Okay, yes, okay, Gandham Vamsi, right? Okay, so sepsis and extreme, okay, infection. Very good, yeah. Yes, Renu, reaction, infection, immune system, tissues, organs, leading, inflammation, blood clots, vessels, significant, high risk, 65 years, diabetic, pregnant. Okay. Catheter also. Okay. Catheter is mentioned here, right? Yeah. So why you don't, you guys are not marking catheter? It is important. Okay. Yes. And yes, Shiny, symptoms. Okay. From text B, it is symptoms. Then blood positioning and what else? Rash, dark red spots, fast heart rate, fever, sweaty skin, hyperventilation and discomfort. Yes, very good. Okay, so that's all about text B. Then text C, we have a pictorial here. Okay, so what are the keywords from the pictorial? Total number of patients with clinical data. So data is one of the keyword that indicates research. Okay. The registry, it is 5,143. Then step 1, ICU acquired infections, it is 1,299. Then comparators, okay, then 1,077, then 232, okay, 622. Severe sepsis, then negative, it is 213. Then 100. Ratio, yeah, ratio is important, 1:1. Okay, CCI, that means the abbreviation, okay? Yep. Yes. Okay, then analyzed it is 100, then a lot of small numbers 72, 33, 20. Neutropenia it is 4. Okay, then infections 2, and the primary immunodeficiency it's 1. Yeah, microbiology also it is 72, 132 excluded. Okay, a lot of numbers, yeah, which comes under the study. Yes, okay. Okay. Yes, Gandham Vamsi, it's infection, immune system 65 DM. Then kidney, disease, burns and wounds. Okay, dear. Renu, different. Septicemia, develop dark red spots, common symptoms, hyperventilation. Okay, Renu, and something else is there. Okay, discomfort is important. Okay, yes, discomfort also it's important. Then Roshna, septicemia, sepsis, rash, red, discolored, dark red spots, reduced urination, heart rate, low blood pressure, shaking. Actually, shaking is not important. Okay, chills and yeah, that's also not important. Confusion, yes. Okay. Then Nimi, septicemia, dark red spots, urinary issue, energy, weakness, fever, chills, pain. Chills are not important. Okay, dear. Okay, Shiny, all numbers, data, ICU, severe sepsis, ratio, abbreviations. Yeah, that's from text C. Very good, very good. Okay. So now it's text D, it's all about the management. So what about the management? How do you treat sepsis? How do you treat sepsis? So sepsis treatment needs to be begin immediately. Treatment needs to be begin immediately. Then the most important concern in sepsis protocol is quick diagnosis and prompt treatment. Okay. If you provide a diagnosis with sepsis, they will usually place you within the intensive care unit or ICU at the hospital for special treatment. You may receive the following treatment for sepsis. So what are the treatments? Maybe antibiotics will be there for bacterial infection, then IV. Okay, fluids will be there. You will need fluids to maintain blood flow to other, your organs and prevent your blood pressure from dropping too low. Then vasopressor medications. Okay, so vasopressors tighten blood vessels. In some cases, you may need them to reach an adequate blood pressure. Then appropriate supportive care. If organ failures occur, you will need other sepsis treatments such as dialysis for kidney failure or mechanical ventilation for respiratory failure. And the last one is surgery. Okay, for that, removed damaged tissue. Okay, and that's all about my keyword from text D, because it's all about the management. So a lot of medicines and the surgical procedures mentioned here, right? Okay. Okay. So what about text D? What are your keywords from text D? Yes. Nimi, Renu, any idea? What are the keywords from text D? Yes. So what are the keywords from text D? And that is the final one. So I'm just waiting for that to know about the keywords from text D. No keywords from text D? Okay, so please comment it here, I'll read. So now I'm moving to the first set of questions, which is 1 to 7, that's called match the following. Okay, so typical contusion seen in patients with sepsis, that is question number 1. Okay, so typical, which means the common, yeah. Okay, chills, fever, discomfort, okay dear, yes. Okay, then, so what about question number 1? Typical, common contusion. Contusion, which means, yeah, in the previous topic, it was contusion, right? So what about contusion? Contusion, which means discoloration. Okay, changes in the color. So that is discoloration. Okay, Vibina, very good dear. Management, sepsis, treatment, concern, ICU, antibiotics, bacterial infection, IV fluids, blood flow, blood pressure, vasopressor, medications. Then tighten, actually tighten is not important, yeah, okay. Supportive care, dialysis, kidney failure, mechanical ventilation, respiratory failure, surgery, damaged tissue. Very good dear. Yes. Okay. So first one, any idea? Common discoloration seen in patients with sepsis. Typical contusion seen in patients with sepsis. So what is the correct answer here? Okay, Shiny, you got that answer. Very good. Any other answers, anyone? Other than that, typical contusion seen in patients with sepsis. Okay, and my answer is B. It's from text B, which means some discolorations mentioned in text B. So in the symptoms, see, this rash makes your skin appear red and discolored. So that means it's from B. So answer is B. Very good, Shiny. Your answer is correct. Okay. So what about others? So please let me know in the comment box what is your answer for the first question. Okay. So second one, how many counts of people had neutropenia? So my keywords, how many, then neutropenia. Okay. So yes, I remember something about this particular word neutropenia when I just marked the keywords from text C. Okay, so it's here. So what about the number of people? It's 4. Okay, so which text? It's from C. So my answer is very good. Yes, C. Okay, okay, Sheba, it's first question, it's B. Okay, dear. Second one, C. Okay, yes, Shiny, it is C. Very good. Then the third one, the supplemental indicators of sepsis. Okay, so my keywords, supplemental and indicators. So indicators, which means the symptoms, signs. Okay, so supplemental, which means other symptoms. So what are the symptoms? Okay, so where they've mentioned about the symptoms. Okay, Rajya Lakshmi, yes, your answer is correct, dear. Second question, it is C. Okay. And third one, yes, answer is, it's from B. Okay, so that's from B. So why it is B? Supplemental, which means other symptoms mentioned. So all the symptoms mentioned in text B. Okay, so we can mark it as B. And yes, okay, Shija, Nimmi, Shiny, it's from text B. Very good. Then the fourth one, who are the most vulnerable contingent to get affected by sepsis? So vulnerable, which means very weak. Okay, easily affected. And contingent, which means a group. Okay, so contingent, which means group. So who are the most easily affected category of people? Okay, so where is it mentioned? Actually, it is mentioned in text A. So where is it mentioned in text A? See, people older than 65 years old, newborns, infants, pregnant people. So they comes under the category high risk category. Okay, which means they are easily affected with sepsis. Okay, so answer is A. Okay, yes, Reba, excellent, dear. Shija, yes, Star Delhi, nice name. Okay, okay, Nimmi and Rajalakshmi, it's A. Very good, text A. Then fifth one, where do the patients are shifted to once they are diagnosed with sepsis, with the condition? Okay, so my keywords were shifted, diagnosed. Okay, so where do the patients are shifted? Okay, and I think it's all about the management they are asking you. So management is mentioned in text D, right? And where these patients are shifted? So if you provide a diagnosis you with sepsis, they will usually place you in the intensive care unit, see, of the hospital for special treatment. So they will transfer you to this ICU. Okay, so answer is from D. Yeah. Okay, yes, Shiny, and yes, Rajalakshmi, it is from D. Very good, very good. And sixth one, how does sepsis conventionally commence in an individual? So conventionally, actually, we have a lot of meanings for conventional. Okay, traditional, natural, mostly used. But here, conventionally, which means usually. Okay, here it means usually. So how does sepsis usually commence? Commence, which means what? Start, begin, onset in an individual. Okay, yeah, it's all about what? The condition, and that means the first para, when it is starting. Okay, so sepsis is your body's extreme reaction to an infection. When you have infection, see how it is starting. Okay, the commencement. So that means answer is from A. Very good, Shiny. Your answer is correct. Okay, okay, dear. It's from text A. Then the last one. Why do we conduct surgical intervention in people who are into sepsis? Okay, so what about that one? Why do we conduct surgical intervention in people who are into sepsis? So my keywords, which are conduct, then surgical intervention. Yeah, so these are my keywords from the seventh question. Okay, so any idea? Why do we conduct surgical intervention? So Surgical intervention, which means one of the management from text D, right? Okay, so answer is D. Yes, so without any doubt we can mark it as from D, it's surgery. Okay, so answer will be D. Clear? Any doubts regarding 1 to 7? Any set of questions? Any questions? Okay, I hope it's clear. So now I'm just jumping to the second set of questions, which is 8 to 14. Those are short answer questions, okay? Whether you can write it in a word or a short phrase, which means maximum 3. Okay, so the first one. Where can we perceive the inception of an abnormal chain reaction that leads to the initiation of clot in the blood vessels? Okay, so my keywords were, then inception, which means the onset, the starting of an abnormal chain reaction. So reaction, yeah, so these are my keywords from 8th question. Where can we perceive the inception, the onset? Okay, yes, so what is the correct answer here? 8th one. Yes, Shiny, Renu. Yes, any other answers? Okay, star, yes, it's clotting system. Very good. Answer is clotting system from text A, right? Clotting system. So where is it mentioned, this clotting system? Okay, so at the same time, an abnormal chain reaction in your clotting system can cause blood clots to form in your vessels. Okay, so that means answer is clotting system. Very good, yes. Okay, Nimi. Yes, Anu Thomas, it's correct. Clotting system. Very good, very good. Then the 9th one. What might be entailed to detach the damaged tissues ensuing from sepsis? Okay, so the keywords entailed, then detach, and ensuing. Okay, so what about that one? What might be entailed to detach, remove? So what we are using to remove the damaged tissue following from sepsis? Okay, or cause from sepsis. So what we are using for that, or what we are doing for that? Very good. Yes, Shija, answer is surgery. Okay, so which is from text D, the last line. Okay, one of the managements, yeah, surgery. You may need surgery to remove damaged tissue. So entail, which means needed. Okay, it is compulsory. It is important. That is entail. So needed. Answer is surgery from text D. Okay. Yes, very good. Last line. Yes. Okay. 10th one. The age must be surpassed by an individual to be the risky candidate for sepsis. Okay. So my keywords age, then individual, and risky. Okay. So any idea? Risky candidates? Yeah, it's mentioned in text A. So who are the risky candidates? Patients older than 65 years old, then newborns, infants, pregnant women. So what about the age mentioned? It is 65 years old. Okay, so answer is 65 years. Very good, yes. Okay, Shiny, it is 65 years. Yes, okay. Renu, answer is 65 years. Okay. Then 11th one. Among the excluded cases, how many of them had catheter-related infections? Okay. So among excluded, one of my keywords are excluded. Then how many? Catheter. Okay, so these are my keywords from 11th one. So what about that? How many? How many? Again, they need a number. How many? Yes. Okay, so that's from this particular, this particular pictorial. So what is the correct answer here? Answer is catheter-related infections, which is 20. Number is 20. How many? 20. Okay, so answer is 20 from text C. Yes, Shija, Reba, yes, Rajalakshmi, it's 20. Very good, very good. And the next one, which drugs would be satisfactory for the patients who have bacterial infection? So my keywords, drugs, satisfactory, and the bacterial infection. So what about bacterial infection mentioned? Where is it mentioned? Bacterial infection and also the drugs for bacterial infection. Okay, so again, one of the management option is the use of these drugs. So what drugs? Antibiotics. You will receive antibiotics if you have a bacterial infection. So what drugs? Which drug? Antibiotics. So answer is antibiotics, right? Okay. Then the next one. What is the peculiarity of 1299 cases in the study group? So what is the peculiarity? In which category they comes under? Okay, so what about that one? 1299 cases. So this is 1299 cases and it comes under ICU acquired infections. Okay, so when you write that, it should be in complete capital letters because it is mentioned in the paragraph as in capital letters. So when you write it, please do write it in full capital letters. ICU acquired infections. Okay. Then the last one, a condition that can also be called a very low temperature. Okay, so what condition? We need a condition, the name of the condition. So what condition? Can also be called a very low temperature. So what is the name of the condition? An idea? Yes. Okay, so that means it's from text B, one of the symptoms, right? Okay, so fever or hypothermia. So answer is hypothermia. 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 That means a very low body temperature. Okay, so that's the correct answer. Then yeah, so that's all about 14 set of questions. So now we are moving to 15 to 20, which are fill in the blanks. Okay, so the first one. Along with tightening blood vessels, dash are also needed to reach an adequate blood pressure. Any idea? What is the missing word there? Okay. Yes, Rajalashmi, it is hypothermia, dear. Yes, correct answer. Okay, so what about 15th one? Which is the missing word there? Which word is missing? Along with tightening blood vessels, dash are also needed to reach an adequate blood pressure. Okay, so answer will be, it's mentioned in text D. Okay, so that is vasopressors. Okay, so vasopressor medications can tighten blood vessels. So answer is vasopressors from text D. Okay, so those are the, or three, that is the missing word from text D. Then 16th one, in dash, the ratio of matching for sepsis severity was. Okay, so any idea, what is the correct answer there? 16th one, in dash, the ratio of matching for sepsis severity was this. So we have two missing words here. So what are they? Any idea? In dash, the ratio of matching sepsis severity was dash. Okay, okay, Shija. Case control matching, and what about the ratio? Okay, so that's from text C. Yes, it is controlled as well as 1:1. Okay, so case control matching and 1:1. So that is the ratio as well as the missing word. Okay, case control and 1:1. Okay, so 1:1. When you write 1:1, it should be like this. Okay. Yeah, so answer is from text C, case control and 1:1. Okay. Then 17th one, people with medical conditions such as diabetes, dash, cancer and kidney disease all belong to high group of sepsis. So what group? Okay, so what is the missing word there? Diabetes, comma, dash. So what? Which means it comes under text A, right? Okay, see, people with medical conditions such as diabetes, obesity, cancer, kidney disease. So answer is obesity from text A. That is the missing word, obesity. Okay. Then the next question, which is 18th one. Sometimes your immune system stops fighting the infection and starts damaging your normal tissues and organs, leading to widespread dash throughout your body. Okay, so widespread what? What is the answer? 18th one. It is again from text A. See, but sometimes your immune system stops fighting the infection. So those are the keywords. Starts damaging your normal tissues and organs, leading to widespread inflammation throughout your body. Okay, so answer is inflammation from text A. Yes, okay, yes, Star Delhi, it is inflammation. Yes, Nimi, okay, Shiny, Anu, it is inflammation. Okay, so what about the last one? Sorry, 19th one. If an infection such as dash triggered your condition, you may develop a sepsis rash on your skin. Yeah, on your skin. So what is that? Any idea? If an infection such as, what infection? Okay, so infection, which means one of the symptom maybe. Yeah. Okay, so what about that one? Okay, so answer will be if an infection such as blood poisoning, or you can write septicemia. Okay, so either you can write in the bracket, septicemia, or you can write blood poisoning. Both are correct. Don't write both. Okay, so either you can write blood poisoning or you can write septicemia. Okay, so that is the correct answer. Then the last one, 20. Other sepsis treatments such as dialysis for kidney failure, so dialysis kidney failure, or dash for respiratory failure are needed if organ failure occurs. So what needed? Okay, so dialysis for kidney failure or dash. So that means it's from text D. Yes, okay, so answer will be mechanical ventilation for respiratory failure. So answer will be mechanical ventilation. Okay, yes, Shiny, your answer is correct. Okay, so that's all about today. I hope you don't have any doubts regarding the session because I have explained it very clearly, right? Okay, so any doubts? Anyone with 20 out of 20 for this part? Anyone with 20 out of 20? Okay, so please do let me know in the comment box how many of you got 20 out of 20. So I'll be very happy. Okay, so that's all about today. So thank you all.